This is a part of a series of supplemental self-guided presentations that you can view at your leisure to get more information about topics of interest to you. My name is Josh Dadolf, and I'm a Caregiver Support Coordinator at the Durham VA Medical Center. In this presentation, I'm going to talk about steps you can take towards decreasing your overall stress and tension by using some relaxation skills. As a caregiver, it's easy to fall into a pattern of neglecting your own needs for the needs of your veteran loved one. It is not uncommon for caregivers to routinely put yourselves last. Ignoring your level of stress and tension can lead to bigger and more disruptive problems. Stress and tension tend to have a cumulative effect, meaning that tension levels tend to build up over time. It is sometimes difficult to recognize that stress levels are building up until they become problematic. Problems with anger and frustration, sleep disruption, even physical and mental health problems can all be attributed to stress and tension. The good news is that there are some manageable steps you can take to reduce your overall tension and stress level. Through today's presentation, I hope we can begin to identify tools and strategies that can help lead to a reduction in your stress and tension experience. I hope to help you begin to develop new, healthier behaviors that will help you manage the natural stress and strain that often accompanies being a caregiver. Although it is important to remember that there are no guarantees and no one-size-fits-all approach, I hope to help you identify some methods that may affect your stress and tension in a positive way. The objectives of today's class will include learning to identify the signs and symptoms associated with stress and tension, identifying tools and strategies that may help you reduce your overall level of stress and tension, and discussing methods of incorporating routine relaxation strategies into your daily routine. Let's take a few minutes to find out a little information about how you experience stress or tension. Go ahead and grab a piece of paper and a pen. I'd like you to write down a few things, and maybe even take some notes. First, I'd like you to take a moment to rate your overall level of stress or tension using a 1 to 10 scale. Consider 1 as being stress-free, with no tension or feelings of stress, and 10 being the most stressed and tense you can imagine. Rate yourself right now, at this moment. Now I'd like you to jot down the top 5 things you worry about. For some, it's worry thoughts about money. For others, they're stressed when thinking about their health or the health of their loved ones. Some may feel stressed or experience tension because they don't feel safe. Think about what you worry about the most. Worry thoughts contribute to one's overall experience of stress and tension. It is important to identify what those worry thoughts are. Next, I'd like you to jot down the top 5 situations that cause you to feel stressed. Perhaps it's being stuck in traffic. Maybe it's when you're running late for an appointment. Perhaps it's having too many tasks to accomplish in too short a period of time. There are a lot of situations that can potentially contribute to one's overall stress and tension levels. It is important to recognize what situations you are in that are causing you the most stress. Finally, jot down a few notes on how you experience stress. Meaning, do you get a headache when you're stressed? Or do you find yourself feeling fatigued? Do your thoughts race? Understanding how your body manifests stress and tension is an important tool in managing your overall levels of stress and tension. And breathe. When we are stressed or tense, our muscles become constricted, which causes us to breathe more shallow than we normally would. This is the body's natural defense when we perceive danger or a threat. Worry thoughts make our bodies react as if we're in physical danger, so the body prepares to fight or flee. When our breathing becomes more shallow, there is less good, clean, oxygenated blood in our bloodstreams. Our muscles react to this by sending a distress message to the brain. Something's wrong, we're in danger, prepare to fight or run. The brain reacts by going into overdrive, trying to process the message that our muscles are sending, along with what is going on around us. It gets confused because there is no immediate danger or threat, and it too is experiencing decreased oxygen that contributes to the racing worry thoughts. By taking a few deep breaths, we can quiet the noise. By breathing deeply into the lower quadrant of our lungs, where the most efficient transfer of oxygen into our bloodstream occurs, we can send a calming message to our muscles to relax. There's no threat or danger. Oxygenated blood also travels to the brain, helping it work more effectively, which will help us with problem solving around our stress and tension. Slowing things down. Caregivers note that sometimes their thoughts or minds race when they're under stress. You may be thinking of the 1,000 things that need to get done, worrying about your veteran loved one, juggling multiple responsibilities, or even concerned about your own health and well-being. These worry thoughts can build upon one another and start to whirl in our heads. It's important to intervene when this happens, as it is a strong contributor to the feelings of stress and tension. Intervening can start with taking a few deep breaths. Take a moment to do that now. Get into a comfortable position, breathe slowly and deeply in through the nose. Really draw that breath deep into the lower quadrant of your lungs. Feel your abdomen expand as your lungs fill with good, clean, fresh oxygen. Then release that air slowly through your mouth. Go ahead and repeat this 2 or 3 more times, and then advance the slide. Once you've taken a few deep breaths, it's time to get into a more positive coping frame of mind. You might want to refer to the iHighFives workbook and resource guide for a refresher in some of the relaxation strategies and effective coping tools. Some tips to quiet the mind include practicing positive self-talk. Positive self-talk refers to that internal voice that many of us have. Many find, particularly when we're stressed, that their self-talk or inner voice is harsh and critical. In fact, you may find that if you paid close attention to your self-talk, you'd notice that your inner voice speaks to you in a manner that you would never tolerate from others. Try using the Acknowledge, Soothe, Redirect method of practicing positive self-talk when you're under stress. First, acknowledge how you're feeling. For example, I'm feeling stressed, or I'm so anxious. Then, soothe yourself. Use your inner voice in a calming and constructive way. If it helps, picture a positive figure in your life, such as an empathic grandparent or benevolent coach. For example, I can manage this. I have the tools I need to get through this difficult situation. Or, I'm going to be all right. I have a strong support network. Next, redirect. Gently guide yourself to a healthy self-care activity. You can set a timer if you're concerned about getting your other tasks done, but allow yourself a moment or two just to focus on you. Take the time to practice a relaxation strategy, engage in a hobby or interest, have a cup of tea or take a brisk walk. Another tip to quiet the mind involves giving your brain a small benign task which can quiet the mind and disrupt the flow of negative or worrisome thoughts. Perhaps you can count in serial sevens, or list your favorite treats in alphabetical order, or try to recall the names of 5 of your favorite songs and the artists who sang them. Another tip is to take some time out each day to journal. Keeping a journal can help you process the day's events. It can help you get things off your chest. It can also serve as a means of keeping track of important details or events. Regardless, it can free up your mind of worry thoughts or concerns and enable you to focus. Another tip involves making lists. Make lists of your important to-dos. Sometimes our stress and worry comes from having too much to do and fearing we'll forget about something important. By jotting these things down on a list, and then referring to it throughout the day, it can serve as validation of your efforts in the completion of important tasks. Having a list reminds the mind that things are being taken care of. If the list is long or complicated, it may be helpful to add action plans or steps that you will take to address everything that is on that list. Like journaling, this practice can free up your mind from the energy spent worrying about keeping track of everything in your head. Finally, as the saying goes, it is easier to blow out a match than it is to put out a forest fire. Your worry thoughts and stress can quickly go from match to forest fire. Use your tools and skills to intervene early when the thoughts and the stress and the tension are at manageable levels. Too late? Well, don't worry. These tools and strategies can also help bring your level of stress and tension back down to a manageable level. Like with most things, practicing these tools and strategies often, particularly when you're not in crisis, leads to feeling more comfortable with these tools and ultimately increases their efficacy. Stressful situations. Sometimes we're in situations that cause us stress or create tension. Some of these situations can be avoided, where some simply must be endured. Think about the situations you are in that cause you the most stress. Are there situations or circumstances that you can predict will likely cause you stress? Perhaps traffic creates stress, or you find yourself tense or anxious in crowds. Now think about what you might do to prepare yourself to cope with the potential stressful situation. You may find it helpful to review some of the stress management and relaxation strategies you learned in iHigh5s. Remember, many of these tools and strategies are super portable and very discreet. Nobody needs to know you're stressed. Nobody needs to know you're using your tools. In addition to some of the self-care strategies we've discussed in iHigh5s, maybe you could plan to listen to a comedian on tape, or a podcast when stuck in traffic, or maybe an activity or puzzle book to occupy your mind while you're waiting at the dentist's office. Perhaps the plan to bring a friend if you're anticipating a stressful situation. Now think about what you might do to avoid potentially stressful situations. You can utilize some of the support-seeking skills that you learned in iHigh5s. You might ask a friend or a family member to come keep your veteran loved one company while you go to your own doctor's appointment. Maybe you can head to the grocery store early in the morning or late at night when there are fewer people around. You might even delegate a task or a chore that you anticipate being stressful to a supportive friend or family member. Using the right tool for the job. There's a saying that reads, "If all you have is a hammer, you start to treat everything like a nail." Remember when I asked in the beginning of this presentation about how you experience stress and tension? That is because there are a variety of different tools that address different types of experiences of stress and tension. We've discussed using deep breathing techniques to address the physical symptoms of stress. If you experience stress or tension in the form of muscle tightness or physical fatigue, you might use some deep breathing or stretching exercises. You may find it helpful to take a walk or turn your face up to the sun to feel the warmth soothe you. You may need to lay down and rest or nap. If you experience stress in the form of racing or perseverative thoughts, you may hit the reset button with a breathing exercise, then practice some positive self-talk. You may give your mind a small task to focus on or perhaps journal your thoughts. You might reach out to a supportive friend or counselor. It may seem obvious, but we cope better, we are more effective problem solvers, and we can manage stress more effectively when we are well rested. As caregivers, being consistently well rested is not always a reality. If your caregiving responsibilities are preventing you from getting a good night's sleep, talk with your support network. Reach out to your caregiver support coordinator or another social worker at the VA. Tell them what's going on and ask for some assistance. Talk with your veteran about talking with his or her provider about any challenges that symptoms or lifestyle may be presenting in order for you to get a good night's rest. If you're having problems falling or staying asleep, you may want to view the Improving Your Sleep module on this site. As well, you may consider talking with your own medical provider about addressing your sleep as a means of managing the natural stress and strain that often accompanies this caregiving role. Get moving. Getting regular exercise can help with managing stress and tension. Whether you experience stress in the form of tense muscles or a racing mind, exercise can serve as a relaxation strategy. Remember when we talked about what happens in the body when we experience a stressful situation? When we are tense or stressed, our muscles become constricted, which causes us to breathe more shallow than we normally would. This is the body's natural defense when we perceive danger or a threat. Worry thoughts make our bodies react as if we're in physical danger, so the body prepares to fight or flee. That energy, if unspent, causes us to feel fatigued. If we take that energy and apply it to going for a brisk walk, we can release that stored up energy. In addition, when we get moving, we tend to breathe more deeply, which facilitates a greater level of oxygen in our bloodstream. This actually calms our bodies down. As well, we can use the exercise time to practice a mindfulness exercise. It is a perfect time to give the brain a tiny task and focus on the things around us. As you walk, you can focus your attention on identifying 3 things you see, then 3 things you hear, then 3 things you smell, then 3 things you feel. Perhaps you can even get your veteran loved one to accompany you on a walk. Remember, fresh air and exercise are good for them too. Avoid alcohol or other drugs. Many people associate recreational drug or alcohol with relaxation, and sometimes then think that this will help them when they're tense or stressed. While their effects may seem like they're contributing to stress management, they are actually simply masking the cause of your stress or tension and drastically reducing your ability to effectively problem solve in difficult situations. In addition, relying on alcohol to relax or manage your stress can lead to greater problems. Alcohol lowers your inhibitions and can lead you to say or do things that you otherwise wouldn't. Alcohol interferes with your thought process and problem-solving abilities. Alcohol can amplify or nullify the effects of prescription medications. Alcohol is a depressant. If you're currently managing symptoms of depression or other mental health issues, alcohol use is strongly discouraged. Alcohol is not good for persons with diabetes or heart conditions, and alcohol use can be habit-forming. As well, relying on substances to relax can lead to greater problems. Drugs can amplify or nullify the effects of prescription medications. Illegal drugs are not regulated. You can never be certain of the potency or even if what you're taking is what you think it is. As such, you can't reliably predict how they will affect you. Prescription drugs taken outside of the parameters of their prescription can be dangerous and even fatal. Combining some drugs with alcohol can also be deadly. If you are currently managing symptoms of anxiety, depression, or other mental health issues, illegal drug use is strongly discouraged. Illegal drugs are not good for you. They can exacerbate existing health problems. They are dangerous and unpredictable. They are illegal and can result in jail time. Drug use can be habit-forming. If you or your veteran loved one are using drugs or alcohol as a means to help you cope with stress, it's important to talk with your doctor about safer alternatives. Giving strategies sufficient time. Experiencing stress and tension can be very frustrating and even scary. As we've mentioned before, stress and tension are cumulative in nature, meaning that oftentimes stress builds up over time. But even when stress hits you out of the blue, be sure to give your coping methods sufficient time to work. Although it is tempting to want a quick fix or a way to avoid feeling tension or stress, it is there for a reason, and it's important to pay attention to. That being said, it's equally important to manage it so it doesn't become symptomatic or problematic for you in your caregiving role. Remember to use your tools and strategies. Remember to count "it helped a little" as a big success. Try not to take your frustrations out on the strategies themselves. And don't be afraid to combine some strategies to increase their efficacy. And by all means, remember to utilize the supports available to you through the Caregiver Support Program. Thank you for taking the time to view this module. If you have any questions or are in need of some resources, please reach out to your local Caregiver Support Coordinator or call the VA National Caregiver Support Line at 1-855-260-3274. Be kind to you and take good care.